Hello, I'm Dr. Doug Teller. I'm an addiction medicine specialist who works out of Kettering Hospital. And in this segment, we want to look at some questions that commonly come up with patients about medications that are prescribed by doctors and dentists and other healthcare providers. Kind of a general question as we get started is to look at about the necessity of pain pills and sedative hypnotics. And it should be mentioned that these medications are very useful medications for specific circumstances. The main problem with them is they are reinforcing, thus have abuse potential, and so monitoring becomes very important when using them. Some questions that are often asked by patients include what should patients be concerned about when they're prescribed multiple drugs like opiates and benzodiazepines. And again, the thing I want to emphasize here is that, that patients should be thinking, okay, how is my physician plan to monitor this, and who else are they going to bring into the fold to help me in the administration of this medication? It's also important to know very clearly what the medication is for and what the potential side effects of the medication might be. And not only for yourself, but also for the home monitors, those people that person live with, other family members, or concerned significant others. If you are prescribed a pain pill and a sleeping pill, should you take them? Again, this combination is one that can be synergistic or have more than additive effects and therefore get a person into trouble. So it's very important to question your prescriber about these medications, and often what happens is it may be that a physician is prescribing a sedative medication, and then maybe a patient goes to a dentist and because of an acute procedure is prescribed a pain pill. And putting this combination together, it's real important for those two entities to be in communication. What sort of questions should patients ask about multiple pain medications? Well, I think again, how long am I going to be on them? What is your accountability plan for me to the prescriber? And also, again, I think I'd very much encourage that any one patient bring their family into things when it comes to medication like this. These are medications that have a very important role, but they have the kind of thing that if left to an individual person could kind of slip away. What is the most important thing a patient can do to reduce his or her risk of becoming an abuser, becoming addicted, or overdosing? Well, first and foremost, compliance and using as the prescriber, be it the doctor, dentist, is intended. If you have any questions about that, certainly consulting with the pharmacist that you're dealing with. And I would even go further and say that each patient should challenge the physician or dentist plan as far as how these medications could be used, and to have an accountability system in place. In other words, who is going to be the monitor? Is it going to be just the patient that is going to self-monitor the prescriptions? How are they accountable to the prescriber, and who's looking out for them at home? The family involvement in the use of medications like opioids and sedative hypnotics cannot be emphasized enough.